Well, we're looking here at the main structures in the gastrointestinal tract. So here we see the nasal passages, and this is the mouth here, the teeth, the lips and the tongue. So food is going to be chewed up in the mouth, that process of mastication, and at the right time the food is going to be projected backwards into this area just here, which is the oropharynx. The oropharynx. Now from there, I'm going to go a bit further down, and to facilitate this process of swallowing, the epiglottis is going to flap down the way over the top of the opening of the airway there, which is the glottis, because that's the airway there. These are the vocal cords, and we don't want food to go down the trachea, obviously, because that's going to cause choking. So the epiglottis will flap down, closing the top of the glottis, allowing the food to go down into the top of the esophagus. The esophagus, of course, is the food pipe. Then there's going to be peristaltic waves in the esophagus, and the food is going to be propelled down through the thoracic cavity and into the stomach here. So this bottom sphincter here is the cardiac sphincter, or the distal esophageal sphincter at the bottom of the esophagus. And we notice that the stomach is here, and the stomach is going to collect the food and is going to store food as it's being digested. So when we have a big meal, the stomach's going to fill up and the food's going to wait there to be digested, but at the same time it is going to be digested. So there's going to be peristaltic waves in the stomach to mix the food up into chyme, and there's also going to be hydrochloric acid and digestive enzymes released from the wall of the stomach. And this top part of the stomach here, that top bit is called the fundus. This main part here is called the body of the stomach, and the lower part of the stomach here is the pylorus. And this narrower area there is the pyloric sphincter. So that's the level of the pyloric sphincter there, controlling the regulation of material, the chyme going from the stomach into this first part of the small intestine here, which is the duodenum. So we've got the organs of the gastrointestinal tract, and we've also got the accessory organs of digestion. And here is the liver, which is one of the main accessory organs. And poking out just there, we can just actually see the gallbladder, which stores and concentrates the bile that's produced in the liver. Once it's produced, that bile will go down the bile ducts and it will enter the duodenum. In fact, you can see the bile duct coming out just there. That's the bile duct there, carrying the bile down through the pancreas, meeting up with the pancreatic duct, and the pancreatic juices and the bile going into the small intestine there, the first part of the small intestine being the duodenum, via this sphincter here, which stops material going from the duodenum back into the bile ducts or back into the pancreatic ducts, traditionally called the sphincter of Oddi. So digestive juices from the pancreas going into the duodenum, such as lipases, amylase and proteases to break up protein, amylase to break up carbohydrates, and lipases to break down fat, to digest fat. But the bile will emulsify that fat in the duodenum, greatly increasing the surface area. So we see that the liver is an accessory organ to the gastrointestinal tract, as indeed is the pancreas. And the pancreas, of course, is a body with an organ with a head, body and a tail. Now after that, the food goes from the duodenum and it goes behind, this is the transverse colon here, so the duodenum actually goes behind there and goes into the next part of the small intestine, represented here on this model, which is the jejunum. So the jejunum is the middle part of the small intestine, and the food will be, well, the chyme from the stomach will be peristaltically propelled through the jejunum and into the last part of the small intestine, which is the ileum. So the ileum is this last part of the small intestine. Most of the absorption takes place from the jejunum and the ileum, particularly the ileum. So by the time the food has been all the way through all this length of bowel, small intestine, all the way to the distal ileum here, it goes through this sphincter here, or this valve, called the ileocecal valve. So the ileocecal valve is controlling the flow of material from the ileum here into this first part of the large intestine, first part of the colon, which is called the cecum. And we also notice that the appendix is a blind-ended pouch from the cecum. And the appendix is rich in lymphoid tissue and may perform some sort of immunological function. So material which is now semi-fecal goes from the distal ileum into the proximal colon, which is the cecum here, that part there. And then peristalsis again in the colon takes material up the colon here. So this part of the colon is the ascending colon. Material going up the ascending colon. Then it gets to this bend in the top right hand side of the abdomen there, and this is the bend near the liver. So it's called the hepatic flexure. So the ascending colon going up, the hepatic flexure, then the transverse colon takes the material across to the top left hand side of the abdomen. And this organ here, just there, the top left of the abdomen, that's the spleen. So that's called the splenic flexure, the bend by the spleen. Then the material is going to go down the descending colon. See the descending colon here. Down the descending colon to the bottom left hand side of the abdomen. And then of course the anus is posterior, it's at the back. So we need a stretch of colon that carries the material posteriorly here, and that is the sigmoid colon. So the descending colon becomes the sigmoid colon. And that takes the food into this, which is essentially the last part of the gastrointestinal tract there. This is the rectum, where the feces is stored immediately prior to the process of defecation. An exit from the rectum is controlled via the anal sphincter just there. So there we have the gastrointestinal tract in essence. And we can actually summarise its function using this model as well. So the function of the gastrointestinal tract is first ingestion. Food is ingested in, swallowed down into the stomach. The next part is digestion. Digestion takes place largely in the stomach and in the first part of the small intestine, although there is a small amount of digestion of carbohydrates in the mouth, for example. But a lot of the protein digestion is going on in the stomach and the duodenum. Still some digestion going on further down into the small bowel, but the middle part of the small bowel, the jejunum, and the distal part of the small bowel, the small intestine, the ileum, is concerned primarily with the third function of absorption. So we've had ingestion, digestion, absorption, and the fourth function is going to be elimination. So the semi-fecal material is going to go into the colon. The watery part of the material is going to be reabsorbed from the colon, because the colon reabsorbs a lot of water. And then the semi-solid feces is going to be eliminated from the rectum and the anus. That's the sigmoid there, taking material into the rectum. And that is the function of elimination. So we have ingestion, digestion, absorption, and elimination, the main functions of the gastrointestinal tract. Now here we see the underside of the liver. So the bile is going to be formed in the liver, and that's going to pass down the hepatic ducts. So these are the right and the left hepatic ducts just here, going into the common hepatic duct, which is that one there. And then the bile from the common hepatic duct is going to go along this duct here, which is the cystic duct. Cyst means to do with bladder. So that one there is the cystic duct, taking the bile into the gallbladder. And in the gallbladder, the bile is stored and concentrated. Then when the appropriate signal comes from the duodenum, the gallbladder is going to contract, ejecting the bile down the common bile duct just here, which joins later on with the pancreatic duct at the ampulla prior to going into the duodenum via the sphincter of Oddi. Now here we get a better view of the descending colon. So we have the transverse colon here. This organ is the spleen. This is the splenic flexure. And this is the descending colon going down the right side of the abdominal cavity. And then it deflects posteriorly and becomes the sigmoid colon. Now in this video we're looking at the gastrointestinal tract in its anatomical context. So we can just take off the ribs first of all. And of course we see these sections of the lungs and the heart. But what we notice is there's this sheet of muscle here, starting way down there, going right up there, down there. This is the diaphragm, differentiating the thoracic cavity above from the abdominal cavity below. Hopefully we can take the heart out. There we are. And we see that diaphragm a little more clearly. Now what we notice here is we have various tubes here in the thoracic cavity. So that one's the aorta. That one's the vena cava. We see the trachea, left main bronchus, right main bronchus, and here we have the esophagus, just in front of the descending aorta below. So we see that the esophagus is going all the way through the thoracic cavity, through a gap in the diaphragm, into the abdominal cavity. And here at the top right of the abdominal cavity we've got the liver. So that's the liver just there. Take this out. Obviously that's the large right lobe of the liver, the smaller left lobe of the liver, two smaller lobes behind. And we also see the gallbladder tucked in behind the liver there. And that lets us see the stomach. So the food's going to go down the esophagus, and that's going to be the cardiac sphincter there on the top of the stomach, between the stomach and the esophagus. And you can see there where the esophagus is coming through the diaphragm, taking the food into the abdominal cavity, with the stomach normally sitting like that. So fundus, body, and this would be the pyloric area of the stomach, just there. And we notice that the stomach then projects backwards to get to this bit here, which is the start of the duodenum. And we notice the pancreas, that accessory organ that we talked about, with the main pancreatic duct going through. Now just there below the liver, posteriorly, that is the right kidney. But on the upper left side of the abdomen here, this organ is the spleen. That is the spleen. So we see that the duodenum goes into the middle part of the small intestine, the jejunum. Just there, so the duodenum becomes the jejunum. This represents the end of part of the duodenum and the jejunum, and that later becomes the ileum. So the ileum is the final part of the small intestine. So that's the transverse colon there. So we can take out the small intestine there like that. And then this final part of the small intestine here is going to take the food into the colon via the ileocecal valve, because this bit here, that is the cecum. So from the cecum we're going to go up the ascending colon. We're going to take that bend at the liver, the hepatic flexure. And the liver's been removed by me. So here we have the colon like that, the transverse colon going across from the right to the left hand side of the abdominal cavity. Then this is the bend by the spleen, the splenic flexure, and the descending colon is going to go down the side of the abdominal cavity. So if someone's very constipated, we can sometimes feel fecal masses. And then we can see that that projects backwards here. So this is the sigmoid colon going back the way. Of course the rectum is behind that. This structure here anteriorly is the urinary bladder. So that just gives us a bit of an idea of the organs of the gastrointestinal tract in more anatomical context. So here we're looking at the anatomy of the liver and the pancreas and the major blood vessels in the abdominal cavity. And first of all we see the liver, and we notice that there's different lobes in the liver. Here's the right main lobe and the left lobe. And over the top of the liver there would be the diaphragm, and above this we have the thoracic cavity. And underneath the liver we notice this organ here, which is the pancreas. And looping round the head of the pancreas we have the first part of the small intestine, which is the duodenum. And we notice that the pancreas is an organ with a head, a body and a tail. And this is the right hand side here, and this is the left hand side here. So we notice that the head of the pancreas is towards the right and the tail points off towards the left. There's a long duct running through the length of the pancreas. This is the main pancreatic duct. Now you might know that the pancreas contains exocrine tissue, and this exocrine tissue in the pancreas produces digestive enzymes in inactivated forms which pass into this central pancreatic duct, go along the pancreatic duct, and under the right conditions are released here into the lumen of the duodenum. Once in the lumen of the duodenum, these digestive enzymes are activated and they will digest proteins, fats and carbohydrates. You might also remember that in the pancreas there is endocrine tissue. The endocrine tissue in the pancreas is often described as the pancreatic islets of Langerhans. The alpha cells in the pancreatic islets produce glucagon, and the beta cells in the pancreatic islets produce insulin. But those products are endocrine. They leave directly in the blood, whereas the pancreatic juices containing the substances to be activated into digestive enzymes, these are the exocrine products exiting the pancreas via this pancreatic duct. Now under the liver we see the gallbladder here, and the gallbladder stores and concentrates bile. So the bile is produced in the liver as the liver concentrates the bilirubin from the blood. The bilirubin in turn is derived from the breakdown of hemoglobin. The bile leaves the liver and goes along the duct here. This is the cystic duct going into the gallbladder. When fatty food especially goes into the duodenum, the gallbladder will discharge bile going down through the cystic duct and down the common bile duct here. Goes down the common bile duct. And the common bile duct actually goes through the tissue of the pancreas. And if we look in here, you can probably see where the gallbladder comes, not the gallbladder, the bile ducts coming from the gallbladder pass down through the tissues of the pancreas. And it meets up with this pancreatic duct. So here, the common bile duct meets the pancreatic duct, and this final area where the ducts are common is called the ampulla. And in the old days that was called the ampulla of Vater. There's also a duct which goes into the pancreas, a duct from the pancreas that goes into the duodenum separately. So that's a smaller pancreatic duct. But the main pancreatic duct is combining with the common bile duct to form this ampulla of Vater, and that is discharging the bile and the pancreatic juices into the duodenum via this sphincter here called the sphincter of Oddi. And the idea is that this will allow material out from the pancreatic duct and the bile duct and the ampulla into the duodenum, but that material cannot reflux from the duodenum back into the bile duct and back into the pancreatic duct. And once in the lumen of the duodenum, the bile will emulsify fats, and once those fats are emulsified, they will be digested with lipase enzymes produced by the pancreas. And at the same time, other pancreatic enzymes will be producing or will be digesting the proteins, converting them into amino acids and breaking down carbohydrates into simpler sugars. And then also on this model we notice the major blood vessels. On the right side we have the inferior vena cava, taking blood back to the right atrium. On the left side we have the aorta, carrying blood from the left ventricle. So this is returning blood to the right atrium, back up the way. This is taking blood down to the lower parts of the body from the left ventricle. And here we can see the bifurcation of the aorta as it becomes the iliac arteries, and here we see the iliac veins taking blood back up. And we can also see this from the back, where we see the major blood vessels, the inferior vena cava carrying blood back up towards the right atrium, the aorta carrying blood down, branches coming off the aorta to perfuse various tissues. Here we see the back of the pancreas, and these are actually the renal arteries taking blood to the respective kidneys. So there we have some of the main structures involved here and a little bit about what they do, but we're going to include some more detail in the next video.